When humans reach the age of 60, the body begins to undergo noticeable changes due to the natural aging process. This is a stage where the body's organs no longer function as optimally as they did in youth. The immune system weakens, bones and joints deteriorate, the cardiovascular system becomes more sensitive, and the body's ability to recover slows down significantly. These changes are not just signs of time passing but also a warning that we need to pay closer attention to our health. At this age, serious health issues can emerge unexpectedly. And what's even more concerning is that they often progress rapidly from mild, easily overlooked symptoms into life-threatening conditions. Aging is an inevitable process. But how we deal with it is within our control. A sad reality is that many people at 60 are unaware of the importance of regular health monitoring or lack the knowledge to recognize abnormal signs. For instance, a fleeting chest pain might be dismissed as a result of fatigue. Or forgetting where an item was placed might be brushed off as a normal part of aging. However, these seemingly minor signs could be alarm bells for serious conditions like heart attacks, strokes, or even cancer. Ignorance or complacency can lead to regrettable consequences when a disease progresses to a stage that's difficult to treat. So why is health knowledge so crucial? First and foremost, it helps us identify early warning signs in our bodies. A knowledgeable person understands that sudden chest pain isn't just muscle soreness. It could signal an impending heart attack. They'll proactively seek medical attention rather than waiting for symptoms to worsen. In contrast, someone lacking awareness might ignore initial signs, only realizing the problem when their body reaches a critical state, often too late. Knowledge isn't just a tool for self-protection. It's also a way to care for loved ones, especially parents or grandparents who are at this vulnerable age. The difference between those with knowledge and those without lies in timely action. An informed person won't hesitate to get regular checkups, listen to their body, and respond immediately to anything unusual. They understand that early detection of a disease can drastically alter treatment outcomes. Meanwhile, those without knowledge tend to dismiss or downplay symptoms, assuming they'll resolve on their own. By the time the illness erupts with clear signs like severe shortness of breath, paralysis on one side of the body, or sudden vision loss, they rush to the hospital in panic, but the chances of successful treatment have already diminished significantly. This isn't exaggeration. It's a reality proven by thousands of cases worldwide each year. Age 60 isn't the end. It's a milestone to live more meaningfully and healthily. However, to achieve that, we need to equip ourselves with a sturdy, shield, health knowledge. Understanding not only helps us prevent illness but also brings peace of mind. Reducing unnecessary worry. Someone who knows how to care for themselves can maintain a better quality of life, continuing to enjoy precious moments with family and friends. Conversely, neglecting health can turn old age into a burden, not just for oneself but also for those around them. In today's era of advancing medical science, accessing health information is no longer overly difficult. We can learn from books, the internet, or reliable health consultation programs. However, not all information is accurate, and it's critical to filter knowledge based on scientific evidence. Moreover, knowledge only holds value when applied in practice. Reading hundreds of health articles without changing habits or getting regular checkups is like water off a duck's back. Thus, acquiring knowledge must go hand in hand with concrete actions, maintaining a healthy diet, exercising regularly, and listening to our bodies daily. This article will guide you through 5 extremely dangerous health signs that anyone at 60 should heed. These aren't rare symptoms but common ones that are easily overlooked. Each sign will be analyzed in detail regarding its risks, specific manifestations, and timely actions to protect your life. From sudden chest pain, weakness or paralysis on one side of the body, to unexplained weight loss, vision changes, and memory disturbances, these are all silent enemies that can strike at any moment. The goal isn't to scare you but to heighten your awareness of your body, empowering you to take the right steps for prevention and early intervention. Imagine this scenario. You're chatting happily with family when you suddenly feel a sharp pain in your chest. What would you do? Ignore it, assuming it's just indigestion, or immediately ask a loved one to take you to the hospital? Your decision in that moment could be the line between life and death. Knowledge is the guide that helps you choose wisely. Similarly, if your parents or grandparents suddenly forget their way home, would you dismiss it as a normal part of aging or take them for a checkup to assess dementia risks? These aren't hypothetical situations, they're daily realities. Ultimately, health isn't just a personal asset, it's a gift to your family. A healthy body at 60 not only helps you live longer but also eases the burden on your children and loved ones. Conversely, an undetected illness can lead to enormous medical costs, months of pain on a hospital bed, and sorrow for those who care about you. So, take the time to learn, listen to your body, and act before it's too late. The next section of this article will delve into each specific sign, providing a comprehensive view and practical steps to safeguard your health at 60. 1. Sudden chest pain or shortness of breath. As people reach the age of 60, the human body no longer retains the flexibility and endurance it once had. Internal organs, particularly the heart and lungs, begin to show clear signs of aging. Among the health warning signs to watch for, sudden chest pain or shortness of breath stands out as one of the most dangerous symptoms, requiring heightened vigilance. This is not a rare occurrence but a direct warning from the body that a serious problem may be unfolding. If not addressed promptly, the consequences could be fatal within minutes. Therefore, understanding this symptom, its causes, manifestations, and appropriate actions, is something everyone should master to protect themselves and their loved ones. Hidden risks. Sudden chest pain or shortness of breath is often linked to life-threatening conditions, with the most common being myocardial infarction, heart attack, heart failure, and chronic obstructive pulmonary disease, COPD. A heart attack occurs when a coronary artery becomes blocked, interrupting blood flow to the heart muscle, leading to damage or death of heart tissue. At age 60, this risk increases due to years of plaque buildup in the arteries, compounded by factors like high blood pressure, high cholesterol, or diabetes. Heart failure, on the other hand, is when the heart cannot pump blood effectively, causing oxygen deprivation throughout the body, often accompanied by severe shortness of breath. Additionally, lung conditions such as COPD or pulmonary embolism, a blood clot blocking a lung artery, can produce similar symptoms, especially in individuals with a history of smoking or prolonged exposure to air pollution. Not every instance of chest pain or shortness of breath leads to a dire outcome. But at 60, the likelihood that these symptoms signal a life-threatening condition is significantly higher. Statistics show that heart attacks are a leading cause of death in older adults, with the golden hour for treatment lasting only about 60 to 90 minutes from the onset of symptoms. Alarmingly, many people mistake these signs for less serious issues, like muscle pain, acid reflux, or general fatigue, leading to delays in seeking medical help. Specific symptoms. Sudden chest pain or shortness of breath doesn't always present the same way in everyone, but there are common characteristics to recognize. In a heart attack, the pain is often described as a squeezing or tightness in the chest, as if it's being compressed or weighed down by something heavy. The pain may radiate to the left shoulder, arm, neck, jaw, or even the abdomen. Alongside chest pain, patients often experience shortness of breath, feeling unable to get enough air even at rest. Some may also have additional symptoms like cold sweats, nausea, dizziness, or a sense of impending fainting. In heart failure, shortness of breath tends to be more pronounced, especially when lying down or exerting effort. Patients may feel suffocated, needing to sit up to breathe more easily, sometimes accompanied by wheezing or a dry cough. With a pulmonary embolism, shortness of breath often comes on rapidly, paired with a fast heart rate, chest pain when breathing deeply, and occasionally blood in the sputum. Crucially, these symptoms don't resolve after a few minutes of rest. They persist or worsen, necessitating immediate medical intervention. Why is this symptom dangerous at age 60? By age 60, the body has endured decades of stress from lifestyle, environment, and genetics. The cardiovascular and respiratory systems, which are vital for sustaining life, become more vulnerable than ever. Arteries may harden, lungs lose elasticity, and the body's ability to self-regulate declines. When an event like a blood vessel blockage occurs, the body lacks the resilience of youth to compensate. Moreover, many people at this age already have underlying conditions like hypertension, diabetes, or obesity, heightening the risk of severe complications when chest pain or shortness of breath strikes. Another factor making this symptom particularly dangerous is its rapid progression. In a heart attack, every minute without treatment causes permanent damage to the heart muscle. If not treated within the golden hour, survival rates drop significantly. Similarly, a pulmonary embolism can be fatal within minutes if not detected and addressed promptly. At 60, recovery chances after such events are also lower due to overall weakened health, making early recognition and action critical for survival. Necessary actions. If you or a loved one suddenly experiences chest pain or shortness of breath, don't hesitate. The first step is to stop all activity. Sit down, rest, and assess the situation. If the pain lasts more than 5 minutes or the shortness of breath doesn't improve, call emergency services immediately. Contact the nearest hospital directly or have a family member take you there. While waiting, avoid excessive movement. Stay calm. And if nitroglycerin, prescribed by a doctor, is available, use it as directed. At the hospital, doctors will perform urgent tests, including an electrocardiogram, (ECG), blood tests for heart damage markers, like troponin, and possibly a chest X-ray or CT scan to rule out other causes. If a heart attack is confirmed, treatment may involve clot-dissolving drugs or stent placement surgery. For a pulmonary embolism, anticoagulants or emergency surgery may be required. Time is critical. The sooner you reach the hospital, the better your chances of survival and recovery. How to prevent it? To reduce the risk of sudden chest pain or shortness of breath, maintaining a healthy lifestyle is key. First, manage cardiovascular risk factors like blood pressure, cholesterol, and blood sugar through diet and medication, if needed. Limit salt intake. Cut back on saturated fats, like animal fat, and increase consumption of vegetables, fruits, and omega-3 rich foods like salmon. Light exercise, such as walking 30 minutes daily, not only strengthens the heart but also improves lung function. Additionally, quitting smoking is non-negotiable if you still have this habit, as it's a leading cause of artery plaque buildup and lung disease. Regular health checkups every 6 months, including ECGs and respiratory function tests, can help detect potential issues early. If you have a family history of heart or lung disease, discuss closer monitoring with your doctor. Finally, listen to your body. Any unusual sensation, no matter how minor, deserves attention. Sudden weakness or paralysis, one side of the body. Upon reaching the age of 60, the human body becomes more susceptible to unusual changes, particularly those related to the nervous system. One of the most alarming signs is sudden weakness or paralysis on one side of the body. Imagine you're sitting relaxing with a cup of tea or strolling in the park when suddenly your right arm lacks the strength to lift, or your left leg can no longer move as usual. This isn't a fleeting or normal part of aging. It could be a sign of a serious brain issue requiring immediate attention. At this age, this symptom is often linked to a life-threatening condition, and recognizing and acting promptly can mean the difference between survival and permanent consequences. Hidden risks. Sudden weakness or paralysis on one side of the body is a classic symptom of a stroke, also known as a cerebrovascular accident. A stroke occurs when blood flow to the brain is interrupted, either by a blockage, ischemic stroke, or a rupture, hemorrhagic stroke. At 60, the risk of stroke rises due to accumulated factors over time, such as high blood pressure, atherosclerosis, diabetes, or high cholesterol. These factors damage blood vessels, making them prone to blockages from clots or weak enough to burst. Beyond stroke, rarer causes like brain tumors or injuries could produce similar symptoms, but stroke remains the most common threat. Strokes are dangerous not only because of how quickly they strike but also due to their devastating impact. Every minute the brain goes without oxygen, millions of neurons can die, leading to permanent damage. Without early intervention, patients may lose the ability to speak, walk, or even slip into a coma. At 60, recovery from a stroke is harder because the body lacks the regenerative capacity of youth. Thus, sudden weakness or paralysis isn't just a symptom, it's a race against time. Specific symptoms. The signs of sudden weakness or paralysis are often unmistakable but can be mistaken for fatigue or muscle pain if not taken seriously. The most common indicators include weakness in an arm or leg on one side, making it impossible to lift the arm, grip objects, or walk normally. Some people also experience numbness, like pins and needles, or a loss of sensation in one side of the arm, leg, or face. Alongside this, other stroke symptoms often appear, such as facial drooping, one side sags when smiling, difficulty speaking, slurred or incoherent speech, and severe dizziness with loss of balance. A simple way to identify a stroke is the FAST rule. *F. Face. Check if the face droops by asking the person to smile. *A. Arms. See if they can raise both arms evenly. *S. Speech. Listen for slurring or difficulty speaking. Time. If any of these signs are present, act immediately. Not every case includes all these symptoms, but even just weakness on one side is enough to suspect a stroke. Notably, these signs can appear suddenly, without warning, and don't resolve after a few minutes of rest. In rare cases, a transient ischemic attack (TIA) may occur, with similar symptoms lasting only a few minutes before subsiding. However, even a TIA is a warning of an impending stroke and should not be ignored. Why is this symptom dangerous at age 60? By 60, the nervous system and blood vessels have endured years of stress from lifestyle and environmental factors. Arteries supplying the brain may harden or narrow due to cholesterol plaques, while high blood pressure increases the risk of rupture. Smokers, obese individuals, or those with sedentary lifestyles are especially vulnerable. When a brain blood vessel is blocked or bursts, the brain loses oxygen and nutrients, causing neuron death in mere minutes. In older adults, the brain's ability to repair itself diminishes, making stroke damage more severe and harder to recover from. Time is critical in a stroke. Medical experts refer to the first 3 to 4.5 hours after symptoms begin as the golden window for interventions like clot-dissolving drugs or other treatments. Beyond this period, damage can become permanent, leading to hemiplegia, speech loss, or death. At 60, many people have coexisting conditions like heart disease or diabetes, complicating treatment and raising complication risks. Thus, sudden weakness or paralysis isn't just a symptom, it's an urgent call to action. Necessary actions. If you or a loved one suddenly feels weakness or paralysis on one side, stay calm but act swiftly. Stop all activity. Sit or lie down comfortably. And watch for other signs like facial drooping or speech difficulty. If any stroke symptoms are suspected, immediately contact emergency services or have someone take you to the nearest medical facility. While waiting, avoid excessive movement. Don't eat or drink, to prevent choking. And if the person is conscious, encourage them to stay calm. At the hospital, doctors will conduct urgent tests, typically including a brain CT or MRI to determine the stroke type, ischemic or hemorrhagic, along with an ECG and blood tests. For an ischemic stroke caught within the golden window, clot-busting drugs or vascular interventions may restore blood flow. For a hemorrhagic stroke, surgery might be needed to control bleeding. The key is not to self-treat or wait for symptoms to pass. Every second counts. How to prevent it? To lower stroke risk, maintaining cardiovascular and vascular health is essential. Control blood pressure, blood sugar, and cholesterol with a healthy diet, low in salt and sugar. Rich in vegetables and fruits, as a first step. Regular exercise, like walking or yoga for 30 minutes daily, improves circulation and reduces stress. Avoiding smoking and limiting alcohol are also critical, as they damage blood vessels over time. Routine health checkups, especially for cardiovascular and neurological health, help detect potential issues early. If you have a family history of stroke or high risk factors, consult your doctor for closer monitoring. Finally, pay attention to your body. Any unusual change, however slight, warrants a check. Prevention is always better than treatment, especially with strokes. Rapid unexplained weight loss. As people reach the age of 60, the human body undergoes numerous natural changes due to aging, from muscle decline to a slower metabolism. However, not all changes are normal. One of the most concerning signs is rapid unexplained weight loss. Imagine noticing your clothes suddenly feel loose or friends asking if you're intentionally slimming down, even though you haven't altered your diet or exercise routine. This isn't something to celebrate. As many might assume, it could be a warning signal that your body is facing a serious issue. At 60, sudden unintentional weight loss is often linked to underlying health conditions, and early detection is key to safeguarding your well-being. Hidden risks. Rapid unexplained weight loss can be a symptom of several dangerous conditions, with the most common being cancer, diabetes, thyroid disease, and malnutrition. Cancer, particularly lung, stomach, or pancreatic cancer, often causes weight loss as cancer cells consume the body's energy or release substances that suppress appetite. At 60, the risk of cancer rises due to years of cellular damage and a weakened immune system. Type 2 diabetes, prevalent in older adults, can lead to weight loss when the body can't use glucose properly, forcing it to burn fat and muscle for energy. Thyroid disease, specifically hyperthyroidism, an overactive thyroid, is another frequent cause, accelerating metabolism abnormally. Additionally, malnutrition in older adults may stem from reduced nutrient absorption, loss of appetite, or dental issues. Whatever the cause, unexplained weight loss at 60 isn't harmless. It's often a sign that the body is grappling with an underlying problem. And if ignored, the consequences can be severe. Specific symptoms. Rapid unexplained weight loss is defined as losing more than 5% of body weight within 3 to 6 months without an obvious reason, such as dieting or increased exercise. For example, a 70 kg person dropping to 66 kg in a few months without trying is a red flag. This symptom often comes with other signs, depending on the root cause. With cancer, individuals may experience persistent fatigue, loss of appetite, or dull pain in a specific area. Diabetes might bring excessive thirst, frequent urination, and exhaustion. Hyperthyroidism can cause sweating, rapid heartbeat, and hand tremors. What's alarming is that weight loss sometimes occurs without other obvious symptoms, making it easy to overlook. You might feel lighter, unaware that it's a sign of internal depletion. At 60, this is especially dangerous because the body has already lost some of its natural energy reserves, like muscle and fat, leaving it more vulnerable to illness. If ignored, Continued weight loss can lead to weakness, infections, or irreversible organ damage. Why is this symptom dangerous at age 60? At 60, the body no longer adapts as well as it did in youth. Metabolism slows, muscle mass decreases, and the digestive system becomes less efficient. When weight loss happens without explanation, it's often a sign that a disease process is stealing the body's energy. In cancer, weight loss isn't just a symptom. It worsens the condition by reducing the body's ability to fight malignant cells. Uncontrolled diabetes can damage nerves, kidneys, and eyes due to blood sugar imbalances. Untreated hyperthyroidism may lead to heart failure or osteoporosis. What's more concerning is that at 60, many people downplay weight loss, even viewing it as a positive because it sheds excess fat. However, this imbalance isn't the same as healthy weight loss through diet or exercise. It's uncontrolled and can push the body into exhaustion before the true cause is identified. The longer diagnosis is delayed, the lower the chances of successful treatment, especially for conditions like cancer, which require early detection for a good prognosis. Necessary actions. If you or a loved one notices rapid weight loss without a clear reason, don't delay. Start by tracking your weight over a few weeks, noting the amount lost and any accompanying symptoms like fatigue, loss of appetite, or changes in bathroom habits. Then, seek medical attention for a thorough evaluation. Ask your doctor for basic tests, such as blood work to check glucose levels, thyroid function, and inflammation markers. X-rays, ultrasounds, or CT scans may be recommended to look for abnormalities. Early evaluation is critical, as each cause requires a different approach. For cancer, early diagnosis could open options like surgery, chemotherapy, or radiation. Diabetes can be managed with lifestyle changes and medication. Hyperthyroidism is often treated with drugs or thyroid surgery. Regardless of the cause, prompt action can prevent further decline and improve recovery odds. While awaiting results, maintain nutrition with small, digestible meals, and avoid self-prescribing supplements without medical guidance. How to prevent it? To reduce the risk of unexplained weight loss, maintaining overall health is essential. A balanced diet with adequate protein, lean meat, fish, beans, carbohydrates, rice, potatoes, and healthy fats, olive oil, avocado, helps preserve energy and muscle mass. At 60, calorie needs may decrease, but nutrient quality should take priority. Staying hydrated and supplementing with vitamins, especially D and B12, supports metabolism. Light exercise, like walking or strength training, helps maintain muscle mass and stimulates appetite. Regular health checkups, at least every 6 months, are an effective way to catch potential issues early. Blood tests and general screenings can detect cancer, diabetes, or thyroid disorders before they trigger weight loss. If you have a family history of chronic diseases, discuss closer monitoring with your doctor. Finally, stay attuned to your body. Any change, even a few unexplained pounds lost, deserves investigation. Sudden vision changes or loss of vision. As people reach the age of 60, the eyes, the windows to the soul, begin to show clear signs of time's impact. Vision may gradually decline due to natural aging, but not all changes are normal. One of the most dangerous signs to watch for is sudden vision changes or loss of vision. Imagine you're reading a book, watching TV, or driving, and suddenly one eye blurs. Strange flashing lights appear, or your vision vanishes entirely for a few seconds. This isn't just a minor issue of old age. It could be a warning of a serious condition affecting the eyes or brain. At 60, this symptom demands heightened alertness, as failure to act promptly could lead to permanent blindness or even threaten your life. Hidden risks. Sudden vision changes or loss of vision can signal several severe conditions, including cataracts, macular degeneration, retinal vascular occlusion, and sometimes a stroke. Cataracts, common in older adults, occur when the eye's lens becomes cloudy, reducing vision. Macular degeneration affects the central retina, making it hard to read or recognize faces. However, sudden changes often point to more acute issues, like a retinal artery or vein occlusion, where blood flow to the eye is blocked, causing rapid damage. Additionally, sudden vision loss can be a stroke symptom, especially if paired with other signs like weakness on one side of the body. At 60, the risk of these conditions rises due to aging blood vessels, plaque buildup, and factors like high blood pressure or diabetes. Another, though rarer, cause is acute glaucoma, where eye pressure spikes suddenly, causing intense pain and threatening vision. Whatever the cause, these changes aren't something to ignore. They require urgent intervention to protect your eyes and overall health. Specific symptoms. Symptoms of sudden vision changes or loss vary widely but share a sudden, unsettling onset. With retinal vascular occlusion, you might experience temporary vision loss in one eye, often described as a black curtain descending, then lifting after minutes to half an hour. Acute macular degeneration can blur central vision, with straight lines appearing wavy or distorted. Rapidly progressing cataracts might cloud vision like looking through fog, with glare from lights. Acute glaucoma presents more dramatically: severe eye pain, redness, halos around lights, and sometimes nausea. Another sign to note is floaters or flashes, bright spots or streaks flickering for 10 to 20 minutes, which could warn of retinal occlusion or a stroke. If these symptoms persist or recur, they're not fleeting. They're a signal your body is in danger. At 60, the eye's ability to recover diminishes, making early recognition and response more critical than ever. Why is this symptom dangerous at age 60? By 60, the eyes and their blood supply have endured decades of stress from light, pollution, and risk factors like smoking or high cholesterol. The retina, the light-sensitive layer at the back of the eye, grows fragile, while blood vessels may harden or clog. When blood flow to the retina is cut off, as in an occlusion, visual cells can die within hours, leading to permanent blindness. Similarly, acute glaucoma can destroy the optic nerve if pressure isn't relieved quickly. Moreover, sudden vision changes sometimes stem not just from the eyes but the brain. A transient ischemic attack, TIA, or stroke can cause vision loss in part of the visual field. And if untreated, the risk of a full stroke rises. At 60, the body lacks the resilience of youth to compensate for such damage. And coexisting conditions like diabetes or hypertension worsen the outlook. Time is decisive. Every minute of delay could cost you your sight or life. Necessary actions. If you suddenly experience vision changes or loss, don't wait to see if it passes. Stop what you're doing, sit down, and assess the symptoms. If vision loss lasts beyond a few minutes or comes with eye pain, dizziness, or weakness on one side, immediately contact emergency services or have someone take you to the nearest medical facility. Even if you only see floaters or brief blurring that resolves, consult a doctor within 24 hours, as it could be an early warning. At a medical facility, doctors may perform urgent eye exams, including pressure checks, fundus examination, and a CT or MRI if a stroke is suspected. For retinal occlusion, medications or vascular interventions might restore blood flow. Acute glaucoma requires immediate pressure reduction with drugs or surgery. Whatever the cause, early care can prevent permanent damage. While awaiting help, avoid rubbing your eyes or using unverified eye drops, as this could worsen the situation. How to prevent it? To protect your vision and reduce the risk of sudden changes, caring for your eyes and overall health is vital. A diet rich in antioxidants, like vitamin A, carrots, greens, C, oranges, bell peppers, and E, almonds, shields the retina from damage. Omega-3s from fish also support eye health. Wear sunglasses outdoors to block UV rays and rest your eyes during prolonged screen time. Managing blood pressure, blood sugar, and cholesterol through a healthy diet and light exercise, like walking 30 minutes daily, lowers the risk of vascular issues. If you smoke, quit immediately. Nicotine harms blood vessels and heightens macular degeneration risk. Annual eye exams are an effective way to catch problems like cataracts or glaucoma early. If you have a family history of eye disease or stroke, discuss closer monitoring with your doctor. Finally, stay alert to any slight vision changes. Your eyes are an irreplaceable asset. Severe memory impairment or confusion. As people reach the age of 60, the brain, the control center of all bodily functions, begins to show signs of aging. Forgetting where you left your keys or struggling to recall a familiar name can be normal at this age. However, if you or a loved one suddenly experiences severe memory impairment or confusion, it's no longer a minor quirk of growing older. Imagine a day when you can't remember how to cook a familiar dish, get lost in your own neighborhood, or feel inexplicably disoriented. These are warning signals that the brain may be facing a serious issue. At 60, this symptom is often tied to dangerous conditions, and early recognition is the only way to preserve quality of life and prevent long-term consequences. Hidden risk. Severe memory impairment or confusion at 60 is commonly a symptom of dementia, such as Alzheimer's disease, or a silent stroke. Alzheimer's, a prevalent form of dementia, occurs when brain neurons degenerate, impairing memory and thinking abilities. Silent strokes, small brain injuries from reduced blood flow, can also cause sudden confusion without obvious signs like limb weakness. Other less common causes include vitamin B12 deficiency, thyroid disorders, or severe infections, like encephalitis, which can produce similar symptoms. At 60, the risk of these conditions rises due to the brain's natural aging, compounded by factors like high blood pressure, high cholesterol, or diabetes. conditions that damage the blood vessels nourishing the brain. What's alarming is that these disorders don't just affect memory, they can alter personality, behavior, and self-care abilities. Without early detection and intervention, patients may lose independence, burden their families, or face life-threatening complications. Specific symptoms: severe memory impairment or confusion can manifest in many ways, but it goes far beyond typical forgetfulness. With dementia like Alzheimer's, you might forget how to perform routine tasks, such as turning on the stove or dressing properly. Getting lost in familiar places, like being unable to find your way home after a nearby walk, is another hallmark sign. Confusion often comes with personality changes, such as becoming irritable, unreasonably suspicious, or losing track of time and place, for instance, not knowing the date or where you are. In the case of a silent stroke, confusion may strike suddenly, making it hard to focus, speak coherently, or understand simple questions. Some people experience hallucinations or intense, unexplained disorientation, unlike normal forgetfulness, like forgetting a movie title. These symptoms persist, worsen over time, and severely disrupt daily life. At 60, the sudden onset or rapid progression of these signs is reason to suspect a deeper brain issue. Why is this symptom dangerous at age 60? By 60, the brain has endured decades of constant activity, and its ability to regenerate neurons significantly declines. Blood vessels feeding the brain may harden or clog with plaque, while abnormal proteins, as in Alzheimer's, accumulate, damaging memory and thinking regions. When severe memory impairment or confusion occurs, it's often a sign that a disease process has been silently progressing. And by this stage, the damage may already be significant. With silent strokes, each small injury raises the risk of a full-blown stroke later. Moreover, at 60, the body lacks the resilience to self-correct as it does in younger years. Someone with dementia might forget to take medication, skip meals, or face accidents due to impaired judgment, like wandering off or leaving the stove on. Sudden confusion could also signal an acute issue, such as an infection or lack of oxygen to the brain, requiring immediate intervention. Left unaddressed, these disorders don't just steal memories, they diminish quality of life and push patients toward complete dependence. Necessary actions: if you or a loved one suddenly experiences severe memory impairment or confusion, don't dismiss it as a normal part of aging. Observe closely. If they can't recall how to do familiar tasks, get lost, or seem unusually disoriented, seek medical evaluation immediately. If confusion arises suddenly with dizziness, speech difficulty, or weakness on one side, contact emergency services or get urgent medical help, as it could indicate a stroke. At a medical facility, doctors may conduct a neurological assessment, testing memory, thinking skills, and reflexes. Brain MRI or CT scans are often used to detect stroke damage or other abnormalities. Blood tests can check for B12 levels, thyroid function, or infection markers if dementia is suspected. In-depth cognitive tests and long-term monitoring will aid diagnosis. The key is to act early, whatever the cause. Timely detection offers better treatment prospects. How to prevent it? To lower the risk of memory impairment or confusion, nurturing brain health is essential. A diet rich in antioxidants and omega-3s, like fish, walnuts, greens, and berries, protects neurons from damage. Managing blood pressure, blood sugar, and cholesterol through healthy eating and light exercise, like walking or yoga for 30 minutes daily, is crucial, as it reduces the risk of stroke and dementia. Stimulating the brain with activities like reading, playing chess, or learning new skills keeps thinking sharp. Adequate sleep, 7 to 8 hours nightly, and stress reduction also support neurological health. Regular checkups, especially for cardiovascular and neurological health, help catch potential issues early. If you have a family history of dementia or stroke, discuss closer monitoring with your doctor. Finally, stay alert to subtle changes in memory or behavior. They could be clues to act before it's too late.